welcome back. It still is Hard Facts at 92.3 Nigeria Info. Sam Oracle Chinedu here. Our conversation for this hour will take us in and out of Nigeria, but it borders on the health sector. That means you should be interested. No fewer than 8 nurses in the country have dragged the Nursing and Midwifery Council of Nigeria and the Minister of Health to the National Industrial Court in Abuja over a new circular stipulating new certificate verification guidelines for nurses. Newsmen gathered that NMCN, which is the Nursing and Midwifery Council of Nigeria, issued a circular on February 7, revising the guidelines for requesting verification of certificates for nurses and midwives wishing to go abroad to seek better work opportunities. The council stated that applicants seeking verification of certificates from foreign nursing boards and councils must possess 2 years of post-qualification experience from the date of issuance of the permanent practicing license. In other words, you must stay here for 2 years and practice before you are allowed to go. This means they must work in the country before seeking greener pastures abroad. Must. Not maybe, not should, not could. You must work in the country for 2 years before you're allowed to go. Naturally, this would meet some resistance. The new guidelines come into effect from March 1. And miffed by this, nurses in Abuja and Lagos protested, demanding the reversal of the new guidelines. Some of the nurses took it a step further and filed a suit at the National Industrial Court, Abuja. Listed as defendants in the suit are Registrar, Nursing and Midwifery Council of Nigeria, the Nursing and Midwifery Council, Coordinating Minister of Health and Social Welfare, Federal Ministry of Health, and the Attorney General of the Federation. When the matter was called on Wednesday, counsel to the complainants, Mr. Ode Evans, told the court that he just received a preliminary objection filed by the first and second defendants in court. So as you can tell, this is a tussle. Whether or not the nurses have plans to leave the country, they will not find these guidelines funny. But I have a nurse who has actually left the country. His name is Kelvin Ossai. He joins me, I believe, from the UK, and he has a lot to say. Good evening, Kelvin. Well, it's evening here. Is it evening over there as well?
It is evening. Good evening, Sam.
Okay.
How are you?
I'm well. How are you doing?
I'm all right.
Okay.
Good to hear from you.
Yes, it is a pleasure. So, time is something we have to make the most of. Straight to the point. Explain it to me like I'm 5. Why are you and your fellow nurses against these guidelines? What does the guidelines say? And what do you want to change about it?
Basically, thanks for the question, first of all. The important thing to note is that it goes against human rights, and it's every human have the right to move about freely where possible, and we have every right to decide where we want to practice. So this circular goes against that. And we already know that as a registered nurse, if you schooled, for example, in Port Harcourt, we know we have a School of Nursing in Port Harcourt. We have a Department of Nursing in Uniport, and I think we have a nursing department as well in UST, if I'm correct. So in the School of Nursing, you're supposed to school for 3 years and become a registered nurse, and then before you start, you're supposed to do PTS, what we call the basic or prelim,
Okay.
the first year and all that. So if you add this number of years to just become a registered nurse, and then to go out and do what you want with the license you paid for by yourself. A lot of us, our parents had to sell markets, sell things, do businesses just to foot our school fees. So this verification guideline goes against every human right in any way. Nurses were not funded. Nurses were not freely trained. So nobody have the right to restrict your practice. Nobody has the right to dictate for you where you should practice. And I could cite an example. For example, let's say I'm a Nigerian based in another country. I'm married, and then now my husband and I say, okay, I'm just using a female example now.
Okay.
Now my husband and I say, okay, let's go home, study, and then you come back. Are you trying to tell me that this person who was not currently based in Nigeria but went back to study nursing, then just to go back to their country, they have to stay back in Nigeria for 2 years? That is totally unfair. That means you're trying to separate families. You're trying to, so these are the issues. It's a barbaric circular, and it goes against every human right possible. In developed countries, nurses can be verified as any time possible, because you should be able to know that the nurse who's looking after you is licensed, is practicing, does not have any restrictions to their license, and any employer should also be able to do that, and it should be available within 24 hours. In the UK, it's available within 24 hours. In the US and Canada and other developed countries, this is the best practice. But in our case, they are saying you have to stay back and practice for 2 years. You also have to wait 6 months for this to be processed. You need to get a letter of good standing from your employer, and also, so these are the things around it. It just sounds as though we are children, we are minors who do not have a right of movement and a right to wherever they want to practice their career.
Okay, Kelvin. Now let's look beyond the new guidelines. Before this was proposed, yes, what was the verification process?
The verification process, as we all know in Nigeria, most of these things still take time. It did take time. It does take a few weeks to months.
Okay.
You could wait a couple of months for it to get sorted, and sometimes 3 months. The excuses were backlog, documents. And the funny thing about these things, I'll just give an example.
Okay.
So I trained as a registered nurse. In fact, just to let you know, I schooled in Uniport. I lived in Choba. I lived in Rumokoro, and several other places in Port Harcourt before I left. Now, let's assume I schooled in Uniport for 5 years. I wrote the council exam. I get licensed to practice.
Okay.
Now I'm seeking a job or a scholarship or something that requires the nursing council to just inform these people that, oh yes, this person is the registered nurse, does he have any restriction? Just something like that.
Yeah.
You're supposed to just look through your record and say, yes, this person is registered. There is no restriction.
Okay.
But then NMCN is now asking that you have to provide several documents, just the way we go to banks and they will ask you to provide NEPA bill, this document. So NMCN is still asking you to provide photocopies of your document, of your certificate, which they issued, license photocopy, which they issued. And these are quite barbaric, but we've been managing that because, of course, we know in terms of infrastructure and IT, most of these organizations do not have records, cloud spaces where they store our records. So we've been managing that. But it is quite barbaric for them to start requesting for 2 years, 6 months, and other things. So this was the process. You pay money as well for them to verify you, something that no other country asks you to pay money, because you already pay your license dues, you pay your registration dues. You're not supposed to pay any money to get verified. So these are the issues that we were managing. When you just manage it in a blind man's world, a one-sighted person is can be regarded as a king. So we're just managing this because that's the situation we found ourselves. But they came up with these restrictions, with this circular, which made it more bottleneck, more difficult for people to get verified. And I'll cite an example. Like I started initially, someone who schooled from Uniport, stayed 5 years in school, would then have to stay 2 more years before they can be verified. Don't forget, this person will also need to serve NYSC, an internship. So that's 2 + 2 + 5 without ASU strike. That's like 9 years for you to be fully licensed and verified that you're registered nurse. It doesn't make sense.
Okay, Kelvin,
and there are some opportunities that you get.
We have a break coming up
carry on.
in about a minute, so I'll have to ask a majority of the other questions on the other side. But very quickly,
right, that's fine.
You say you guys pay for the verification. How much were you made to pay?
It was about 60 something thousand naira. It was
Okay.
about 60 something thousand naira. But now I'm hearing that it has increased, which I've not even checked the current price. Some person said, and also don't forget the current situation of Nigeria, there is no customer service, there is no direct portal for you to make. There is a portal for you to make this payment, but then sometimes you have to send documents through somebody to
Mm.
somebody, and you have to pay for some other things, making the expenses to be as high as 100 and something thousand. And the
Okay.
average salary of a registered nurse in most private hospitals is between 30 to 50,000 naira.
All right.
And
So
that's very
we'll
ridiculous.
take that break now, and after that, of course,
All right.
we talk some more. Please stay with us.
All right. Thank you so much.
Welcome back. It's still Hard Facts in 92.3 Nigeria Info. Sam Oracle Chinedu here. I'm having conversations with a Nigerian UK-based nurse. His name is Kelvin Ossai, and he is talking about the nurses who have taken the Nursing and Midwifery Council of Nigeria and the Minister of Health to the National Industrial Court over a new circular stipulating new certificate verification guidelines for nurses. Kelvin, are you there? Hello, Kelvin?
Yes, I am.
Okay.
Sam. Yes, I am.
Welcome back. Okay, so you were telling us about the displeasure with the new guidelines before the break. And the question I wanted to ask was, does it seem like this is targeted at people who might want to practice abroad? Or does it also affect nurses who might want to practice in Nigeria?
In myopic, a very short-lived point of view, it is meant to be targeted at those who are planning to move abroad to practice. And we all know the reason why people move for greener pastures. And a lot of people are currently moving out and into the country. We already have people who are foreign nationals who are working in Nigeria, and we also have Nigerians who are moving abroad to work. There's a lot of opportunities globally, and that is supposed to bring positive things into the country in terms of foreign exchange, people sending money back home, coming back home to set up businesses. So these are targeted because the registrar or the nursing council feels that it's because don't forget, recently we had a news where the presidency is urging Nigerians abroad to return home, to doctors and all that, to return home and boost the healthcare sector. We also had news back then when there was some saying that you have to stay back 5 years before you start planning to move abroad. This was targeted at doctors. But that didn't come into limelight. But then all of a sudden, there was this circular against nurses, and it's targeted to prevent nurses from moving abroad. And what they said was because the healthcare sector is short-staffed, there is brain drain. But I can assure you from some of the documents we have received, at least every state in Nigeria has at least 2 to 3 schools of nursing. These are state and federal. And then we also have some schools of nursing by some other hospitals. So in almost every state, you have at least 2 to 3 schools of nursing. And each of these schools produce ranging from 50 to 150 nurses twice a year. So just to make it clear, the nursing workforce in Nigeria is not short-staffed. There is no statistics showing that the nurses are short-staffed. Rather, we are having higher volume of nurses who are in the streets unemployed, because most of these hospitals or private hospitals prefer to employ staff and cheap services, and then they employ 1 or 2 nurses and they say, oh, this is what we'll pay you. And you have nurses who are being paid 30,000, 25,000 in most of these communities. The government is not really recruiting, and this is why most people are moving abroad, because there is global opportunity for nurses. But then this circular has just been brought in, a barbaric circular that tends to reduce or truncate that dream of registered nurses to move abroad. Whilst this appears to be that this is the only plan, they've forgotten that nurses who tend to look for scholarships or have plans of getting to go into master's programs abroad or some other opportunities globally in terms of WHO and things like that will definitely miss out on these opportunities, even if they have to do it while still in Nigeria. These organizations need to verify that you're a registered nurse, so they have to miss out. Then multinationals, we know that we have multinationals in Nigeria. We have Total, we have Schlumberger, we have Shells, as some of these foreign industries or nationals who industries who have their bases in Nigeria, they may not be able to recruit nurses again, because you need to wait 2 years for you to be verified. Gone are those days when nurses finish from school and they are gainfully employed straight from school into the teaching hospitals and government hospitals. Now nurses are out in the streets looking for jobs, and this is why they want to move abroad. This is why people want to also further their career. Some persons have plans of being in Nigeria, but they want to school abroad, then gain experiences, and then come back to Nigeria. But it just appears that this NMCN circular is directed and targeted to mitigate these dreams and truncate people's dream, and that is totally unfair.
All right. If you have any contribution to the subject, please call 0817-923-0002, 0817-923-0003. Some nurses have sued the Federal Ministry of Health and the MDCN, I believe, for a new circular, new guidelines, connected to their verification. And so Kelvin, who joins me from the UK, is speaking against it. Please turn off your radio as you call. I believe we're live on Facebook and Twitter at Nigeria Info PH, so you can watch as you listen. More importantly, contribute via those platforms. We have just around 10 minutes for this conversation, so you want to call now if you'd like to contribute. Now, Kelvin, I believe you'd agree with me that no responsible government will be satisfied with the brain drain that Nigeria has. If you have your people living at this rate, you have to be concerned. Maybe I might not go about it like this, but it definitely is the cause for concern of any responsible government. Do you agree?
I do agree with you that it calls for concern. However, I do also believe that, as it has always appeared, the Nigerian government do not always solve the root cause of problems. However, they just prefer to chase shadows. For example, you have your house burning and there is smoke coming out. Instead of you to quench the fire, you go about covering the windows so that the smoke does not go out, or you go about painting it from the outside so it doesn't look as though it is burning.
Wow.
The reason why there's a lot of brain drain is the high rate of unemployment, high rate of crime, social insecurity, kidnapping, and a lot of it. If you go to UPTH as we speak, that is where I train. In the evenings, you see that there is no materials for the nurses to work. Patients are being asked to buy their own medications, drip, glove, gauze, infusions, and all those things. A lot of things in the night when you go to the hospital, there is usually no lights, and the mosquitoes are as big as my hand. I can tell you that if you go to UPTH A&E in the evening.
Kelvin, when did you leave? When did you leave Nigeria?
They don't solve these things.
When did you leave Nigeria?
When did I leave Nigeria? 2019.
Yeah. What if I tell you? If I tell you the mosquitoes are not that big now? The latest report as of today.
I know. The latest report, they are not that big.
Yes,
but
the
mosquitoes.
Hello, good evening.
That is the.
Good evening, Mr. Tam.
Yeah, good evening. What's your name?
Good evening to the guest. Obed Chima. I'm calling from Port Harcourt.
Okay, go ahead.
Mr. Sam, there's something one of your guests said. I think the government of the day, instead of them solve the root cause of the problem.
Oh my. Obed, can you hear me?
I can hear you.
Okay, please go ahead.
Yeah, they present window dress. So I think the actions of the federal government is wrong, honestly.
Okay.
Look, the only solution is to make a better working condition that can attract this nurse to stay back.
Okay.
Other than for you to do that, you are going the other way around, trying to prevent somebody. It's even infringing on the right of their right.
All right, Obed, thank you very much. I'd implore you to go straight to the point. JJ, please, you have to go straight to the point so I can take other calls. You're welcome.
Sam, good evening.
Good evening.
I want to ask, when they were...
Hello?
Hello?
Yeah, go ahead.
Yeah. Any form
Oh, my. JJ, the line is breaking. I can literally not hear you. Please call back if you can. Isaiah from Buguma, very quickly. Go ahead.
Yes, Oracle. You see, what is happening, this is called wickedness in high places.
Wow.
You understand? Now, instead, just like your guest is saying, to put the society in order in this part of the world that makes people seek for greener pastures over there. Now you are putting restricting measure to make sure that you restrict people from moving. why the law enshrined in our constitution give us the right and freedom to move about naturally. Even before that law was enshrined, naturally it has been there by God that we have the freedom to move around. You understand? So I want to say, now if you look at the ROSSDA, it is a board where River State government during the former, I think, Rotimi Ameshi's government.
Oh, apologies, I lost that. All right, so Stephen on WhatsApp says, if our government wants our nurses to stay back to practice, why do our leaders and the same government officials going abroad for medical care? That's a question from Stephen. Okay, so Kelvin, did you hear the callers?
Yes.
Okay.
Not really. I also tried to go on YouTube to stream, but I was not really getting some of the questions.
Okay, so basically they are, of course, sharing your sentiment and resonating some things that you say. I have 2 minutes on the clock, and we must wrap this up very quickly. So, my question for you is, there have been conversations held around how it is cheap to train a doctor or nurse in Nigeria compared to other countries. In some countries they have student loans, and if you compare the tuition, that Nigerians have it better. So, what if this is a way, and it's a what if, since your education is subsidized, you owe us some service before traveling?
I'm just going to laugh, not at you, but at that sentiment. The reason I'm laughing is because the cost of, I live in the UK, and the average cost of rent in UK cannot be compared to the cost of rent in Nigeria. The cost of taxi or cost of the daily activities in Nigeria cannot be compared to the cost of those same things in overseas.
Very quickly, so Kelvin, we're literally out of time.
It's a reflection of the society where you see the cost of that training is a reflection of the society you find. So it is not subsidized in anywhere. Okay. If we tell you the amount of money nurses pay to be trained, you would definitely shout.
Okay, so finally, Kelvin, we literally have 30 seconds. If nothing changes about these guidelines, what's the way forward?
The way forward is that we have protested, we have pleaded, we have done social media, we have used every possible route. We have informed, the House of Rep has been informed, and they told the NMCN to halt that verification. We have protested. Now we have gone to court, so we are following the due process, and we hope that the justice will be served.
All right, thank you very much, Kelvin. I wish I had more time to speak to you. I'm sure that I would reach out, for some updates on this. But thanks for speaking with us.
Thank you so much, Sam.
My pleasure. All right, stay with us.